everybody, and we are really honored and extremely excited for this conversation we have with Alejandra Mendez. I'll give you a short brief about who she is and what she's been through, and so we realize the privilege of having her on the call today. So Alejandra is the mother of a childhood cancer survivor, and post this experience she really devoted herself to any child who kind of goes through the same thing, and works non-stop or relentlessly to improve the quality of life of patients and survivors and the families. As far as the professional background is that she currently serves as the vice president of Childhood Cancer International. She is a board member of another child organization in Chile. She's also the co-chair at the SIOP Global Health Network, which very closely works with the patient, family, and stakeholder engagement. She's a member of the SIOP PARC Committee, which is the Program for Advancing Research and Capacity for Pediatric Clinical Trials for Cancer Patients. She also represents, on so many forums at a multiple local level, international congresses, including the WHO, the WCC, CCI, and SIOP, amongst others. She currently is based in Santiago in Chile, and she's a mother of 3 sons. And it's just so absolutely lovely to have you on the call, Alejandra, and we really look forward to some amazing conversation as we go ahead. So handing it over to you for the rest of the presentation, and then we'll take it forward from there.
Thank you, Neeraj, for that introduction. Thank you for your nice words. It's an honor and a pleasure for me to be here and to have the honor to talk to you, meet you. And I'm very happy and grateful for this opportunity of sharing my perspectives. And I have a lot of things to talk, but I'm mainly here being the mother of Pablo, a childhood cancer survivor. And I'm just want to share my experience and happy to answer all the questions and comments, and happy to engage in a conversation afterwards. So if this is okay, shall I share my screen?
Yeah, absolutely. Please go ahead.
Okay, can you see my screen now? Can you see my screen?
Yes,
Yes.
I can. Thank you.
Okay, so my goal here today is just to highlight the importance of being sensitive when we are communicating about cancer, and to reflect the impact that language may have in some patients and their families. So you already introduced me, but I just want to say that I'm the mother of Pablo, a childhood cancer survivor. Pablo had a clear cell sarcoma, relapsed with a bone marrow, then a brain, and then relapse in the thyroid. He had 2 BMTs, and today, as you can see in the picture, I have to update that picture actually. He's happy, healthy man. So I'm very proud of that.
Wow.
So I'm just going to focus on war metaphors when talking about cancer. This is just one specific thing I'm very interested about. Years ago, I realized that there was something that really struck me when people use military language to talk about cancer. Being the mother of a childhood cancer patient, I heard this terminology extremely often. Something in my brain and heart was uncomfortable every time I heard them. Why did I feel so uncomfortable and uneasy? What effect was this language having in me? I started doing my own little research among the hundreds of families I work with today, and I realized that I was not the only one. I've also met so many childhood cancer survivors in my journey, and realized that for many of them, this was uncomfortable as well. The use of language may have a big impact on people's view of a situation, any situation. Just to give some context, until the mid-20th, most patients diagnosed with cancer were almost given a death sentence. In 1971, President Nixon declared the war on cancer in the United States. Humanity needed that after the devastation caused by cancer. But today, things have changed. We all know that in 2024, most cancers are curable. Therefore, I think it may be time to return cancer to its condition of being a disease and not a war, and start treating cancer like any other disease. We don't talk about other diseases such as heart disease, kidney disease, diabetes, using military language. Just want to share this short video.
I can't hear it, so if you can maybe
Can you hear now?
No,
Can you hear
I
now?
can't. No, I can't hear it.
Okay, okay. Oh, sorry.
No worries.
Can I just stop sharing? And I'm gonna share the. Can you see the screen now?
Yes.
Okay, there we go.
Jesse, if you
Can you hear now?
Yeah,
Yes.
better.
There is time. Why would I go to the party? That party is for kids who beat cancer. I lost. Cancer doesn't have winners and losers, and anyone who makes you feel that way does not know what they are talking about. You made me feel that way. The stupid speech. I was 12 when I learned I had cancer. I was told I was in for the fight of my life. I battled each cell of my sarcoma. New Amsterdam taught me how to fight and how to win. Your party is called Fighting Cancer. So, yeah. Cancer won, and I lost.
Language always matters. When
Mhm.
speaking about a disease, it matters a lot. And when speaking about a disease with a child, it matters even more. It matters because it affects how children live with their illness and relate to those around them. As adults and professionals working with sick children, we have an obligation and an opportunity to choose language that is respectful, accurate, and empowering to patients. Children love to dress and play like superheroes. Sick children enjoy this as well. When playing, children choose to be a ninja or a Superman. They're free to take this role and quit when needed. Children know that they are pretending and that the game will end when they decide to. What if the game doesn't come to an end? What if the kid feels he or she can't leave behind the superhero outfit? On the contrary, what if he is forced to wear it for a long, long time? Is this a mandate to keep being Batman after the game has ended? How do we use the word cancer? And I want to reflect on everywhere around the globe. Consumism, relativism, inflation, ignorance, indifference, selfishness. What impact may this have in patients who are diagnosed with a disease? Oh, there's one more. Let's go beyond that. I can't even begin to count the number of obituaries that include the phrase, lost the battle with cancer, or other war terminology. Celebrities and non-celebrities, athletes, singers, TikTokers, parents, ninja warriors, and of course, children. Have we stopped to think the impact this language may have in patients and their families? Are we really communicating? What are we really communicating, even if we don't intend to do so? Okay, so Jean Piaget's theory of cognitive development suggests that children move through 4 different stages of learning. His theory focuses not only on understanding how children acquire knowledge, but also on understanding the nature of intelligence. The concrete operational stage is in the 3rd stage of this theory. The period begins around age 7 and continues until approximately age 11. And this is characterized by the development of logical thought. Before the age of 7, children rely heavily on concrete thinking. Child psychologists think that only at 11 is the beginning of abstract thinking, when children gradually develop the capacity to analyze, extrapolate, and develop the capacity to understand metaphors and other kinds of figurative language. So children have a concrete way of thinking. Young children may have difficulties to understanding some forms of communications, humor, irony, idioms, and figurative language. So they need to begin to think, they start to begin to think symbolically and may understand metaphors or symbols eventually in their life. So this is what we hear when you are in a hospital or in a cancer setting. I understand these expressions are used with the intention of supporting and motivating patients and their families, but this is not always the case. We may understand the metaphor, but the patient may not always do so. We, all adults here, know that children who die from cancer, or adults who die from cancer, have not died because they didn't try hard enough, or because they didn't have the right attitude. Is that the message we're passing to them? The language we choose to talk with a child or a patient with cancer about the disease may have profound attitudes. Is a warrior a positive figure? Does this help the patient? Superheroes are never afraid. They choose a cause to fight for. They are proud to defend this cause and would be happy to give their lives for it. They know what to do and won't hesitate to do it. They have special powers or weapons that make them unique. Are these the expectation we have from a patient who's diagnosed with cancer? What do you see here? A child? A kid with cancer? Or a brave hero fighting an enemy? Is something in the kid's body that needs removing? Or is this a kid warrior in a war he or she may win or lose? What matters is not what we understand or think, but what is the message we are passing to the patient. Cancer and its treatment can be grueling. Patients usually feel tiredness, fatigue, nausea, or other side effects that make day-to-day living difficult. But the social mandate received is be strong, brave, resilient. Be a strong, brave, resilient patient, and you will win this war. Fight like a superhero. Don't be afraid. Don't you ever give up. Don't be a loser. Fight back. Be positive. That suggests the language may dehumanize the patient. When we use certain language, patients report that they feel these emotions are not allowed to be expressed. Real emotions of fear, anger, frustration are not allowed to be showed. The use of words has the power to engage and include or to wall us from those with whom we most need to communicate. Patients need to talk about their emotions, and adults should be aware of that. We must teach and encourage the patients to express their feelings and ask for help if they feel overwhelmed. Some patients are unable to open up as a result of the expectations they feel people have of them. This is important for their mental health. Learning to cope and express your emotion is probably the basis for a healthy adulthood. Are negative emotions during cancer negative? Emotions like sadness, fear, or anger are expected in the cancer process. We should allow the patient to express these emotions, not to suppress them. I understand that many patients may feel inspired by the idea that they are fighting for their lives. There are no right or wrong words for people talking about their own personal experience. And some may see their cancer experience as a fight or a battle. And if this is the case, patients and their families should proceed using the words that connect them with the goal of becoming healthy. And for them, this language is totally okay. But other patients find that the effort of keeping a brave face is exhausting. There's no such a thing as a typical person with cancer. So people have different preferences when it comes to discussing it. So what does the sick kid or the sick patient perceives? This is a message they see. You need to fight like a warrior to win this battle. In fact, we all know that if the patient survives or dies, has nothing to do with his or her attitude or his or her willingness to survive. Aren't we putting the responsibility of the cure in the patient? Is this what the patient may perceive? Why to put this burden in the patient? If only the progression of cancer depends on being more or less positive, but it is not so. Attitude does not cure cancer. The progression of the disease depends on other factors, such as the stage at which it was detected or the outcome of the treatment. Despite this, many times patients and their families receive certain messages from the environment that, despite being very well-intentioned, end up being very difficult to manage emotionally in a society already marked by the dictatorship of happiness. So we know there are many benefits of being positive. You reduce the tension, anxiety, and tiredness, lower rates of depression, better coping skills during difficult times, improve psychological well-being. A good attitude will definitely help us to deal better with the disease and to lift our spirit. These advantages can be helpful for those undergoing cancer treatment, but will not cure a patient with cancer. I'm sure everybody in the room have met extremely positive patients who have died of cancer, despite their optimism and their attitude. Studies have shown that keeping a positive attitude does not change a person's chance of survival or the course of their disease. A positive attitude helps, but cannot control cancer growth. Who is really fighting cancer? The patient or the scientific team? The ones who are fighting cancer is the medical team. They need to defeat the disease, to cure the patient, make the right decisions, choose the medications, decide the procedures. Researchers need to figure out how to solve this problem. When a patient dies from the illness, it doesn't mean he or she didn't fight a good fight. It's just that in those cases, neither the drugs or the surgery or other therapies could stop the malignancy's progression. If the patient survives, the medical team succeeded. If the patient dies, the medical team did not succeed, not the patient. The patient's job is to cope with secondary effects and emotions and just wait to be cured. So let's talk about this toxic positivity. All of us who have been in the hospital with a patient or a relative who is sick have heard these kind of comments. There are many worse things. There are people who are worse off. You must have the best attitude. If you're sad, your family will be sad too. Have we thought or have we stopped to think what is the impact of these very common remarks has in the patient and in the family? I think we live in as I call it, a toxic positivity or dictatorship of happiness. With the best intention of making the patient feel good, adults try to downplay the illness with phrases like, cheer up, it could be worse, don't worry, you have to be strong, attitude is important to cure your illness, you have to stay positive. Initially, the patient may not feel overwhelmed, but reconsiders them when receiving certain messages from the environment. Sometimes these phrases can have the opposite effect. The patient feels guilty for the normal feelings that are overwhelming them during the illnesses, and maybe not being able to be happy and optimistic all the time. So what are the consequences? When the need for emotional release is blocked, suffering increases, generates a lack of control. I don't know what will happen if I can be more positive. I am not up to the situation. I should be better. Things could get worse if I can be more positive, and it will be my own fault. I have to be well so that the others, the ones I love, do not suffer. It's better not to say anything because they won't understand me. So just to finish, I have some suggestions when talking about anyone other than yourself or your own children. Use clinically accurate and specific terms to describe the patients and the illness. Stop referring to cancer as a personal battle of the patient. Use language that encourages the patient to show real emotions. Avoid speeches that romanticize cancer. Avoid using the word cancer as a metaphor or synonym for distraction and corruption. And just, I want to get a thought for the families. What happens when the families lose a beloved ones? I'm just going to share two quotes from mothers I personally met.
Sure.
When their child dies. You feel like you're letting people down if you can't manage to be always positive, or if you have an emotionally hard day. This is not helpful when trying to focus on getting through the day-to-day of a cancer diagnosis and treatment. I'm just trying to cope with each day at a time, hoping this ends soon. And the next quote is from a father whose daughter passed because of cancer. My daughter did not let herself to be defeated. She tried so hard. She never refused any procedure, even if painful. She kept smiling and hoping to be cured. She didn't lose the battle. Hearing that leaves me with a bitter feeling. Her death was not her defeat. Anyone with the experience of a cancer knows well the kind of looks you get after the diagnosis. With this presentation, I hope that we all have reflected on the language we use when talking about cancer and consider that maybe the use of military terminology is making patients more fearful and fatalistic about this curable disease.
Mm-hmm.
Maybe framing cancer in military terms may have a negative impact on how people think about cancer and cancer patients. Maybe when using the brave, fighter, warrior images, we are putting an awful lot of pressure on the patients diagnosed with cancer. Maybe the patients feel a social mandate to be brave. Maybe the families feel the same mandate. Maybe it would be easier if we use another type of language. And just to finish, I'm going to end with a poem. I'm not brave, I'm not strong. I don't want to be a superhero. I don't want to be inspiring. Please, don't expect me to be so. I never chose to be here. I would have never chosen this path. I would have chosen for my family to live an ordinary life. I would have chosen for my son to have a happy childhood, but I wasn't given the choice. Let me yell that I'm sad, angry, scared, exhausted, and overwhelmed. Don't call me or my son a brave warrior. Don't expect us to fight any battle. This is not our war. This is the scientists' war. They are the ones fighting, trying to defeat cancer. They will lose or win this battle, not us. We are the battleground. We will only cope with the effects of their war. I trust they will dare their best armors and weapons. I know they will. Please do all you can do to save our lives. Only you can do it. There's nothing we can do from this side. All I can do is to be by my son and try to cope with our feelings. So I just want to say thank you for listening to me, to my dear friend Angus, who make all the drawings in these presentations. Thank you for listening to me, and I'm happy to answer any question or comments that you may have.
Sure. I think, let's take a moment to settle this in, because, this is so touching. And yeah, I'm still processing a lot of these slides. So this is tough. Yeah.
I just want to say that this is my experience when, as I mentioned at the very beginning, my son was diagnosed when he was 2, and he relapsed when he was 6, 8, and 10. So we lived the whole experience basically many, many times. And this is what happens to myself, to my family. And I don't want to say that this happens to every patient, right? After my son's disease, when I recovered from that, I devoted my whole life to work with patients and their families, with the mothers, siblings. And literally, I've come to learn that this is happening to many families, to many patients, that the social mandate is so powerful, and that they cannot really, they don't feel that they can express their real emotions. And I think it's helpful to express your feelings, to let them out, to share your emotions. Sometimes you just need somebody to hug you, and when you're crying, just pass you a little tissue paper, right? That helps sometimes much more than people saying you have to be strong, you are inspiring, you need to have you have the best attitude. Sometimes it's good, and this is just an advice, when somebody is undergoing this, try to give them space to these people to share the emotions. Sometimes that's very liberating, and sometimes there's not too much to say, just maybe hug and maybe cry together if it's necessary, or just listen to the emotions that people might be having.
Absolutely. And I think this is just so very important to kind of look at all these emotions and kind of try to understand it differently for different people, because it just triggers a different response. In fact, I've also been thinking about this for a while, and I think the first thought that comes that the word cancer has been so much overwhelming for people, or it has been defined to be overwhelming. That earlier, when the treatments were not available, hope was something that you wanted to live by, right? You wanted to be hopeful. You wanted to be, looked in that framework of just creating hope. So has this, thing about creating hope taken this terminology to this level where you say, okay, let's hope to win this war. Let's hope to build this. Let's hope that we will pass it on to this together. So do you think that hope and this anticipation of these words kind of go hand in hand when the treatment was not that strong, and, maybe when it was not available at this level now?
I think that hope is super important. And personally, I think that hope is something, as a parent, you never lose when you see you're sick, as a child is sick. I think I haven't met so far parents who say like, this is it. I think parents will always have the hope that even a miracle or doctors or something will happen. So I think hope, it is important. And I think it is important that we can just, of course, pass messages of hope, right? Pass messages of hope. But then passing messages of hope, and at the same time, giving the opportunity to the patient and families to express. When your child gets diagnosed at the beginning, you are probably, that's what I've seen, neglection, or you just think this is a mistake, this is not possible. It takes a few days to understand exactly what was going on and to accept your new situation. The whole life is going to be changing from the minute you hear your child has cancer, or your family, your relative has cancer. So I think it is important to acknowledge all the emotions that will come through. First is like an unbelievable saying that it's not true, negation, saying it's a refusal to believe. And then anger, of course, anger will come. And then, of course, it's going to be sometimes a lot of frustration. And there's a lot of things that will be becoming, and I think it's important to acknowledge them. Do not always give a message of hope, but acknowledging the different emotions that are going to be coming. And fear, terror comes, is part of the process. And I think it's important to acknowledge within the message of hope. Okay, this will go up. Now you're feeling this, but eventually things might get better.
But how do we build sensitivity and compassion in these kind of conversations when, when they're in the hospital? I can understand that, yes, there are doctors, there are nurses, there are counselors who are with you. But the minute, they kind of come back home, or they have, they know that they have a long battle, where is the space for them to express this? And how do we create the space for them to even express or even have such sensitive and compassionate conversations, which do not overrule this entire, or rather acknowledge the fact very deeply, saying that we understand what you're going through.
That's a great.
Together. So how do we build this entire?
That's a great question. And what I feel and what I've seen so many times, and I think it's culturally, not culturally, it's like globally, when you finish treatment and you go home, or in between treatments and you go home, those of us, or those of people who has not lived cancer, will be in the mood of like celebration and expecting celebration. And you have parties. I remember we had the last chemo party, and when we arrived home, people would be celebrating with balloons and whatever cultural ways of expressing happiness and joy. And my personal experience, I remember there was like a little party at home with all the cousins were there, and they were expecting us to be happy and grateful. And I was happy and grateful, but at the same time, I wasn't grieving. I needed to grieve. My son was alive, but we had spent a whole year in the hospital. Of course, many things have happened, right? Seeing your child in pain, seeing your child spend a year in a hospital and not in the playground or at school. Probably you're grieving because of like you feel the guilt of leaving behind other siblings or family members. Professionally, you have your profession was, of course, interfered. Many times you see problems within the relation husband and wife, or sibling and mother and father. So there's a lot of grieving, even if and actually that's something I've been writing about. That grief is not only about death. There's grief about an illness, right? So trying to, when somebody, as your question was, when somebody finishes or ends treatment, or is in the process between treatments, asking, how are you feeling? Are you in the mood of celebrating? Are you in the mood? Do you need to talk? And usually what I see is that people need to talk about the many things they're grieving. It takes a while to be ready for celebrations, or to be ready to fully believe that this has ended. You live with a sense of fear, I would say, terrified that this will come back. And one sentence I always say is that cancer doesn't end when the treatment ends. There's a whole journey after treatment ends, living with secondary effects, the fear of recurrence, the grieving of all what you lost in these years or months. So there's a lot of cancer still after treatment. It still lures or stays with you for a long while.
So let me ask you a very a different tangential question. As the old saying goes, men are from Mars and women are from Venus. So even within a couple, a husband and wife treat the whole process very differently, right? One has a very emotional bent of mind, the other has a very logical bent of mind. One expresses feeling, one bypasses feelings. So how does, even between a couple, that they reconcile this? Or rather, how do you have a conversation with the other partner during this stage? And I think that communication is like the most super important part of the whole journey. So, what was your experience, and how do you also advise people kind of with this?
I think you're totally right in the sense that women and men are usually very different. And there's different ways of living or going through these super hard processes. Actually, we have grieving groups here, also in St. Jude, where I've been collaborating, for fathers and for mothers differently. Sometimes having the groups of parents, it's because you don't feel what others is saying resonates sometimes with the father or with the mother. So having grieving groups or talking communities with fathers and mothers, it's different. But within the couple, I think it is important to understand what you're saying, that we are different and each of us will be living our own process differently, and not to expect that your partner, in my case, I'm married, and my husband was living his process in a very different way than I was living it. And we learned to respect the other, and to not to expect the other one to be feeling the same thing that you are feeling. So talking about that, and again, I think it's the openness. Again, it goes back to the essence of my presentation, giving the room and the positive attitude of being open to receive and listen what is the other one feeling, not only in terms of a couple or married, but also between the relationship with the patient. not just always trying to give this social mandate that you need to be strong, you need to be inspiring. I remember, this is an anecdote, somebody was sent me a little card and saying, oh, you are an inspiration to us, or ta-da-da. And I was like, I don't want to be inspiring. I hate to be inspiring. I just want to be myself. And I just need to say that I am not, and I was saying, like, I'm not brave. I'm so scared. I'm so horrified. And I think I'm really, I cannot live with this and I was like, I am not strong. I'm super weak because I'm very scared. And we ended up laughing, and that opened up a conversation. And she enabled me to really talk about my fears and my real emotions, instead of just giving me the mandate that we think you are inspiring. You know what I mean?
Oh, no, absolutely. I think that is so important to honor your own emotions, because then you will be able to really take care of the patient better. Also, on a different complexity, let me, frame this differently for you. Uh, the child knows a little bit of what's going on, right? And somehow in India, we have this opinion that the child need not know everything that is kind of going on with the treatment. And sometimes even the parents don't open up fully well to the child, and kind of, especially the older children who are about 7 and kind of are in the age of understanding exactly what's going on, because they hear the words chemo, they will hear the words radiation, they hear the words treatment, cancer, and all of that. How do we enable this communication to seamlessly happen between a patient, a doctor, and a family?
Even though we're very far, I think our cultures are not very different in that sense. Here in Latin America, we have the same feeling of like kind of protecting the child, of knowing everything. And it makes sense. If a child, or maybe a young adolescent, needs to know according to his or her age, right? But I think, and I've been working with a lot of childhood cancer survivors who become to being young adults and honestly have no idea of what they went through. We, the parents, want to protect them and pass them very little information. They know they had cancer, they know their diagnosis was leukemia or whatever, but they don't know exactly what will happen to them. And I think it's very important that young survivors need to know and be very aware of what are the potential side effects, long-term side effects, what are the potential, mental health issues that may arise. And they need to know for their future, if they had a vancomycin or whatever chemotherapy they need to know if they go to a doctor, the doctor in the future, the parents will not always be there. So they need to know, hey, I had this, I may develop potentially heart problems because of this drug. So I think it is important to inform the child using the right, but using the right words. This is cancer, you're going to have chemotherapy. These are, so he or she will come. This is, unfortunately, this is going to be part of their lives forever, right? Forever, they need to be aware of surveillance of some side effects, and so they need to learn to live with this new identity. They will be patient cancer survivors for good, until for many, many years, we know. But they need to be fully aware and fully understand and fully acknowledge that this is their new identity. So I think it is very important for the medical team to pass the information to the family, and to the family to pass the information completely to the child in a process, little by little. But there comes a moment when the child or the patient needs to be fully aware of the situation. So I think it is important that from the very beginning, you use the right word, like cancer, chemotherapy, radiation, bone marrow transplant, or whatever, immunotherapy. They need to understand, and these are going to be words that they need to get used to. So.
Okay. Oh, that's beautiful. And I think, somewhere down the line, I think we need to build a common vocabulary that can be used by all of us, and maybe translated even in different languages,
Yes.
to kind of really build this and have like a forum of discussions where we keep, I think, talking to each other on a regular basis to understand, okay, I have come up with this situation, how do we handle it? I've come up, so that over time, I think over a 2-3 years of discussion, we're able to come together and maybe prepare some basic document, I think that can be as a point of
Yeah.
reference for both parents and kind of patients.
As I said at the beginning of my presentation, I think a cancer patient is a cancer patient. It's not a warrior. A
Sure.
cancer patient is not fighting a battle. It's getting treated for cancer, right?
Correct.
And I think that's it. We need to treat to give cancer the status of a regular disease. We know that now it's curable. I'm very happy to say that our survival rates are getting higher every day. We're getting, which give us a big responsibility because the population of cancer survivors is growing worldwide. So we need to make sure that these survivors have the best quality of life, and the mental health is super important. And if they've been for many years, they have the pressure, the social mandate, or they felt the mandate to be that they're warriors, strong, super, that they have inspiring, and I think that's very important. And also something that really calls my attention is that when we talk about survivors, we usually want to give these inspiring sessions, and what the patients see are survivors who are running marathons, who are getting, big things, or maybe they are like writing a super book that is a bestseller. And I think that's fantastic. And I think it's very inspiring. But I think it's important that survivors, what they want to do is to have a normal life. What they want to do is eventually to have a family, to have a work, to have a happy life, to play a
Exactly.
sport, but nobody wants to go to the Olympic Games, right? I mean, if they go, it's fantastic, but that's not something they should. And I think that cancer survivors feel the pressure that they need to do something very important or very big, that they have to pay back for this opportunity. And I think that this is okay if they want to get a Nobel Prize, fantastic. But I think we should try to make this burden lighter. Because you survived cancer, it doesn't mean that you need to be the best, I don't know, to get a gold medal in any sport. You can have a happy, normal, simple life, and that's okay.
No, absolutely. And I think this conversation is so important, both from the caregiver perspective and also the patient guilt, that the patient carries or having put through the entire family. He assumes that he has put the entire family at so much trouble and so much kind of confusion and chaos and how much tension because of him or her that has been created. So there is obviously even a strong element of the patient guilt that a patient carries through this entire survivorship. And how do we enable through these conversations for him to get over that and start looking at life even differently? And I think that's
Feeling
going to be very,
differently.
very critical as we age. What I'm going to do now is let's open up for questions from the audience. We have a very interesting person, Shraddha, here. And Shraddha has just recently written a paper that was published on the psychosocial need for patient and caregivers in the pediatric oncology space in
Nice.
India. And
Sure.
she very closely worked with Dr. Mahati, who you had a chance to speak, I think, for one of the conferences together. Um, so I would open it, with you, Shraddha, for any questions, any comments or conversations, and then we can kind of move on to the rest of the audience. You have to unmute yourself and ask the question.
Thank you. Thank you so much, Neeraj, for such a lovely introduction. And of course, for having Alejandra do this talk, because I think this is so important. And thank you so much, Alejandra, for this amazing talk. I think your personal experience mingled with your years of expertise really shone through this. So first of all, I'd like to say that I loved the talk. And it really took me to my fieldwork, which was the greater part of last year, where I was interviewing parents of children with cancer in India. And I think everything that you said really reflected there. Because the parents, the needs that the parents expressed were all about them wanting a safe space to process their child's illness, to process the life-turning event that just befell them. And I think it's incredibly important for us to understand this, the concept of a more I can say, a language that caters to or suits the idea of illness in the patient's and the parents' minds. So if the patient and their parents have a pact that this is something they call the illness, or this is how they communicate, and if that works best, I think maybe is that something that we should look at in the future as well?
Totally. Totally. The way we're communicating with the parents, and it is very, very important to give them the space or the opportunity to get their real feelings out. And sometimes just starting with you're fantastic, you're strong, we're so proud of you. How are you? And then, of course, you're not giving them the space. So maybe starting the open questions differently, right? In terms of like, I know this is hard. How are you feeling? And then you're just giving the whole direction. Or I cannot imagine how this is. Can you let me know what the feeling? So things, just little ways. And that's something that really helps. It's like when you are talking from the medical perspective, sometimes sitting across the table, it gives you some distance. What I've learned is when I talk to my patients, I just stand up and sit next to them, not in front. You know what I mean? Sitting next to them, depending on the culture. In my culture, it's okay to hold her hand or their hand, and just, it immediately connects you differently. So there are little concrete ways, and I would be happy to share. I gave a presentation once about this, about how to be active listening and how to create this way of connection. So little things like, again, using the child's name or the parent's name always, and sitting next to them and getting the questions, like not just stating a sentence first, like, we are so proud of you, you are being fantastic, and then asking. So little things that really help. And I think it would be very important to create, as you were saying before, maybe this kind of protocol or something to share. And I think this is, and I'm very happy I've been training or working in the training with the WCC and the St. Jude in Memphis team, sharing my experience and trying to, and I think it's interesting because usually you hear things like, they never taught us this in school, because this is something you learn with the experience. It cannot be taught in a class. So I think, and I'll be very happy to team up or jump in with you, Shada, and creating this kind of materials. For me, it is a pleasure trying to make the road easier for those families who come after us.
Absolutely.
That sounds incredible.
Yeah.
Thank you so much. I just had a small follow-up question. I'm so sorry. I know Sheetal's hand's been up for a while, but just in that follow-up with what Neera said as well about the parents really feeling that that burden, and I feel like we don't say the word burden enough, because that's what the parents have acknowledged, that it really can be, especially in a country like India, where the economic part of a child being unwell is really heavy on the family, and plus when the parents have to make decisions about the child's the treatment path, or whether to continue or to not do that, whether to put them in palliative care and all of that. So many parents said that they felt guilt, and they were so worried whether they were making the right choices. And that's why I love that you said that, we need to ask them first how they're feeling, rather than kind of projecting our ideas of them being brave or strong. Because inside, the parents could be feeling really guilty and worried, and not very sure about what they're doing there. Until they find that reassurance with the medical team. And you were so right in saying that the medical team has that onus of fighting and providing resources. So thank you so much on that. I hope I've not talked too much time.
No, Shada, one thing I want to think it's very important, and I really like what you said. I like to say that usually before people talk about patient-centered care, and I think we should call it now a family-centered care, where the whole family, if it's an adult, maybe the spouse or the husband or the wife, or maybe if it's an old person, maybe the adult children or the parents, it's a family-centered approach. And what I think looks very, very easier, or I mean, it works well to make the burden easier, It's like when the family is involved in certain decisions and in the treatment. What we've been doing, and something that's really helpful, is like the parents are giving we teach the parents with some relief techniques for soothing the pain of the children. For example, massaging the foot. This is not going to interfere, of course, with the medical treatment. This is very important. The parents are not going to be giving medication or, but if you train the parents to give massage in the foot for the painful, maybe when you're having a epidural or a lumbar puncture or something that's painful, this little thing makes the parents feel engaged in the process and they feel part of the team, of the healing team. And you feel, and I'm saying the parents, but it could be the spouse or anybody in the family. The fact that you're involved in the treatment gives this whole sense that you're being part of the healing process of your beloved one, right? And we teach, and we have other techniques like, if it's a child, making, being the parent, the one who will be choosing the flavor or something, things like that, that of course are not going to interfere with the medical. Even we have trained parents or beloved ones to give some palliative care to the patient when time comes. And the whole perspective of including the family, sometimes even the siblings of a child in the process, makes the whole thing differently. The perspective is different, that we are all together healing or in this journey of giving easing the pain or healing your beloved one.
Yeah, that's so well
That's
said.
wonderful.
Yeah, absolutely. I would agree to Shraddha. I think that was so wonderful. And I think one of the things that we want to do at BMT Support Foundation is to engage in a 3-year research where we are able to map the entire end-to-end patient cycle and map what kind of interventions can we create or what kind of interventions are absolutely necessary at what stage of the process. And I think this is something that has, it's not been done at the rigor at which we want to do across in India. So we really want to do that as a project. And we are hopeful that, we get the funds this year to start that project and really work. Because then
Fantastic.
we will be able to come to some kind of a understanding of what kind of mental health interventions, psychosocial
Totally.
interventions, or
Mental
physiotherapy
health.
interventions, and all of that is kind of needed at what stage. How do we provide what forms? Can it be a video? Can it be a conversation? Can it be a group therapy? What can we do with these kind of processes? We don't have that understanding, and I think we are very keen that we build this understanding as we kind of go along, so that our processes remain very solid and centered, as you said, around the family processes.
Family-centered care, and especially I'm very concerned about it when it's a child, about siblings. The siblings, I usually call them these forgotten kids with cancer, because as I was telling you, myself, I've never been diagnosed with cancer, nor has my husband. And I have 3 boys, only one was diagnosed with cancer. But the 5 of us, my husband and my 3 sons, we all feel like cancer survivors because we all lived the disease. We all lived the bone marrow transplant. So I think the interventions ideally would need to be as a family-centered care with a spouse, with the patients, with the parents. And I think that I love when you said at the very beginning that you were having some breathing techniques, yoga techniques that I was thinking like incorporating the whole family for one kind of, for this kind of sessions would be so beneficial for the mental health of the family.
Sure. And I think Sheetal has been raising her hand. So
Oh, yes, I see.
the next question. Yeah, please go ahead.
Hi, so I have 2 quick things that I noted. The first one is going back to the word hope, of how and when and what doses of hope is required. And I think that's a question that we can, it's more like a process. It's not a question to be answered, but a process of when do you feel hopeful, or when is it okay to feel hopeless? Once in a while, it's just fine.
Yeah.
And to add to it, what, I cringe at the word survivor, because and I'll tell you the reason. It's not just during the treatment, but even after the treatment is over, we usually never use the word COVID survivors. So many people died of COVID. Did we say there are COVID survivors? We did not. So this word survivor is only attached with cancer, and it becomes like a personality of the person. So now whenever somebody refers about or speaks about Nirad, they would say, oh, he is Nirad Trivedi, a cancer survivor. I'm like, hello, he is much more than that. He spent maybe 20 years as the vice president of a company, and cancer was just there for 2 years maybe. But why is it that that becomes the prime element that uh, talks about his what he is? It's like a surname, a second name, and I don't like it. So how do you work at this not becoming your personality type? Because otherwise, every other disease will have survivors, typhoid survivors, chickenpox survivors, and
Yes.
so on and so forth. And why should we have this? Because the word survivor then goes back to what you showed in your presentation, which is the fighting, the warriorship, or the hero. All these, if you look up the synonyms of the word survivor, you will see that all this is attached with that area. And like I said, how do we avoid? So my primary question with all this PhD that I've done is, how do we avoid this survivorship becoming a personality of a person or getting attached to the introduction? What do we do about it? Because that's something which it keeps you reminding that, oh, you had cancer once upon a time.
Mhm.
And that may,
I understand. I understand your
Yeah.
point, and it's something that it's been discussed globally a lot. And usually, people who has undergone cancer or have suffered cancer, kind of like struggle to define a word about that. And I totally understand, and I think it's true that you don't want cancer to be your main to define who you are. So that's why I think that it is important that we to the community who's undergoing treatment now, to show that the expectations is to have a normal life, to have a happy life, to have a regular life. You don't, not because you have cancer, you are supposed to, I mean, it's fantastic that some people will, fund and create an NGO to support people who are going, but you don't need to do that. That's your choice. So I think that that's important to this thing that because you had cancer, you need to do something big because you are a survivor, right? And I think that that's the point. And I think I really don't like when we see people are trying to, and I understand that it's done with the best intention. You see this survivor who is an astronaut, and there's this woman who is an astronaut and went to the space ship or whatever, which is fantastic. But I think she happens to be a childhood cancer survivor. It's not that because of this, she is an astronaut. So I think that's a message that I think we need to try to give and to sing. So that's why I think that, and I'm going to speak my personal opinion here, when my child was in treatment for all these many years, it really gave me hope. And I go back to the beginning of your question, Shita, when you said hope. And when I was in the clinic and I saw patients who came just to checkups, and you see people who were, a regular young adult, and you can see, and I was looking at them, and even if they wouldn't talk to me, I was just look at them, and I saw my child, who was of course bald and looking very sick, but I could see those healthy looking people, happy looking people, who would be there just because they had to check up, and that was the hope I needed. That was the hope I needed, and I will go a little beyond. I saw myself, my husband, my other siblings, we were all living in this, turmoil and devastation. But then you look at those people and you see that their family looked very normal. They were, I don't know, things that sounded like, this may sound a little crazy, but I remember once I saw this mother coming to a checkup, and the mother was wearing a little makeup. And that showed me she was living a normal life. She woke up in the morning, she put a little lipstick, went to the clinic, and then probably would go to to work again because she was wearing like a suit. So I thought, wow, she's wearing a lipstick, a suit. She has a life, right? And that gave me hope, you know. And you could see that there was life after cancer, and that's a happy life, normal life, things like that. So I think that's important to focus on the messages we are passing. Show, and the people that if you go to a conference and you want to inspire people, show normal people, normal families, people who got married, have a happy life, have children, maybe is working on something simple. And I think that's what we need to, the message we need to convey. Life after cancer can be a happy life, normal life, simple life.